Hey there, parents! In today's video, we're diving into what you can expect during a baby growth ultrasound. If you're curious about how these scans work, what they reveal, and why they're so important in tracking your baby's development, stick around. This is all about making sure you feel informed and confident throughout your pregnancy journey. A baby growth ultrasound is one of the most exciting and reassuring experiences for expectant parents. It's a moment where you get to see how your baby is developing inside the womb and gain insights into their growth. Whether this is your first pregnancy or you've been through it before, the thought of an ultrasound can stir up a lot of emotions, from joy to nervousness. Understanding what to expect during a baby growth ultrasound can help put your mind at ease and allow you to enjoy this special milestone. When you go in for a baby growth ultrasound, it's all about checking how your baby is progressing. These ultrasounds are usually done in the second and third trimesters of pregnancy to ensure that your baby is growing at a healthy rate. During the scan, the sonographer will take measurements of your baby, including their head, abdomen, and limbs. These measurements help doctors estimate the baby's weight and track their growth over time. One of the first things that will happen during the appointment is getting set up on the examination table. You'll be asked to lie down, and some warm gel will be applied to your belly. This gel helps to create a good connection between the ultrasound device and your skin, allowing the sound waves to capture images of your baby. The ultrasound transducer, a small handheld device, is moved around your abdomen, and that's when the magic happens. You'll see your baby on the screen. The images can be quite detailed depending on how far along you are in the pregnancy. You might see your baby's tiny hands, feet, or even their facial features. The sonographer will talk you through what you're seeing, pointing out key parts like the baby's head, spine, and heartbeat. Sometimes, you'll be able to hear that precious heartbeat as well, which can be one of the most memorable moments for parents. If your baby is in a good position, you may even get a glimpse of their movements, like a kick or a stretch. The primary focus of a growth ultrasound is to check that your baby is developing well. The measurements taken during the scan are compared with standard growth charts to ensure your baby's size is within the expected range for their gestational age. If your baby is measuring smaller or larger than average, your healthcare provider will discuss what this means and whether any follow-up scans are needed. Another key aspect of a growth ultrasound is checking the amniotic fluid levels around your baby. Amniotic fluid is essential for your baby's development, and too much or too little can signal potential issues. The ultrasound helps ensure that these levels are just right. The scan also provides a chance to check the placenta's position and function, ensuring it is delivering the necessary nutrients and oxygen to your baby. Sometimes, parents worry that the ultrasound will reveal something concerning, but it's important to remember that ultrasounds are a routine part of prenatal care. Most of the time, they confirm that everything is progressing as it should. However, if any concerns do arise, your healthcare provider will guide you through the next steps. It's also worth noting that while baby growth ultrasounds can give a good indication of your baby's size, they're not always 100% accurate. There's often a margin of error in estimating the baby's weight, especially in the later stages of pregnancy. So, if your baby is measuring a bit larger or smaller than average, it doesn't necessarily mean there's a problem. Your doctor will take the full picture into account before making any conclusions. In some cases, you might be offered a 3D or 4D ultrasound, which can provide even more detailed images of your baby. These types of scans are often used for a clearer look at the baby's face or movements, but they are typically considered elective, meaning they're not a necessary part of medical care. If you choose to have one, it can be a fun experience, but a traditional 2D ultrasound is perfectly sufficient for checking your baby's growth and development. After the ultrasound, your healthcare provider will review the results with you. If everything is progressing well, you'll likely feel a sense of relief and excitement. If there are any issues that need to be addressed, your provider will explain the situation in detail and discuss any additional steps or monitoring that may be required. The baby growth ultrasound is not just a critical check on your baby's health, but also a bonding moment for parents. Seeing your baby on the screen makes everything feel more real and can help strengthen that emotional connection long before birth. It's also a great time to ask any questions you might have about your baby's development or anything else related to your pregnancy. So, whether you're feeling excited, nervous, or a bit of both, knowing what to expect during a baby growth ultrasound can make the experience more enjoyable and less stressful. It's a wonderful opportunity to see how far you've come on this incredible journey and to get a glimpse of the little one you're eagerly waiting to meet. Thanks for tuning in. I hope this breakdown of baby growth ultrasounds has helped you feel more prepared for your next appointment. If you found this video helpful, don't forget to like, subscribe, and hit that notification bell for more tips and insights. See you in the next video, and happy parenting!